Assalamualaikum and welcome to my YouTube channel. My name is Farah Naveed. I am a dental laboratory technologist. Today, I am describing content on Dental Articulator in which I select Non-adjustable Articulator, which is also known as Hinge Articulator. It is commonly used in undergraduate level in dental colleges and also in dental laboratories. Before starting, do not forget to subscribe my channel for more content like this. I hope after watching my video demonstration you will understand it better. So let's start. So begin with the introduction of non-adjustable articulator. It is a simple non-adjustable articulator, a basic device used to simulate the static relationship between the upper and lower teeth. It provides a fixed hinge axis and condylar inclination, means it does not allow for adjustment to mimic the natural movement of the jaw. This type of articulator is primarily used for basic procedures because it has a restricted mandibular closing arch, generating clinically relevant changes in the position of the centric contact and the direction of force and ridges of the prosthetic restoration. Part of non-adjustable articulator consists of two members, upper member, lower member. Upper member hold the maxillary cast, whereas the lower member hold mandibular cast. Hinge allow the articulator to open and close, simulating basic jaw movement. In this section of the video, I will demonstrate how to properly mount maxilla and mandible cast on the articulator, discuss the use of mounting plaster or sticky wax for cast placement. Before starting articulation, sticky wax is used to seal the occluded teeth to prevent the model from moving out of occlusion during mounting. Hinge also called plain line articulators since they permit only vertical motion, that is simple opening and closing of hinge-like movement, can be parted in upper and lower member easily as shown in this video. Simple hinge with a screw against a metal plate posteriorly serve as a vertical stop to increase or decrease the distance between two parts of articulator, that is upper and lower member. Things required in articulations are bowl and spatula, dental plaster, water to mix, simple hinge articulator, and Vaseline. So before starting the articulation, after the occlusion has been sealed by the sticky wax, we use a separating medium, namely Vaseline applied on simple hinge articulator members for easy demounting cast after the teeth setup or trial visit of the patient. So dear student, now this is the segment where we mount the cast on the articulator. We previously learned that the upper lower cast are sealed with sticky wax. The arms of the articulator to be used are lubricated with Vaseline. Now we will follow the incisal guide in which we follow the incisive papilla as a midline to place the cast while we mount the plaster. So the bowl should be parabolic in shape and resistant to abrasion. Plaster should be stiff blade, and one more thing, that entrapment of the air in the mix must be avoided to prevent the porosity lead to weak spots and surface inaccuracy. For that, we can use the vibrator while mixing the dental plaster, or you can simply do the tapping as I have shown in this video. The mixture should be creamy homogeneous mix which is ideal for placing the plaster during articulation. We have a lot learned about the practical demonstration on articulation. Now discuss about its advantages and disadvantages. So the in advantages, we have simplicity, cost effective and quick setups. They are straightforward to use, making them ideal for basic procedure or educational purpose. cost effective in such a manner that they are less expensive as compared to semi-adjustable or fully adjustable articulator. They require minimum time, which can be beneficial for quick assessment. On the other hand, we have the negative side. Their use often leads to restoration, which occlusal discrepancy because these instruments do not have the capacity to reproduce the full range of mandible movement. Insub discrepancies can be corrected intraorally, but this is often time consuming and lead to increased inaccuracies. If discrepancies are left incorrect, occlusal interference and associated neuromuscular disorder may result. Dear students, in conclusion, hinge articulator can be effectively used in simple cases such as Canby's classification 3, bounded saddle areas where there is muscle support of both sides, medial and distal, or in academic practical session. However, considering its disadvantages, this type of articulator should be avoided in complex cases such as full arch restoration or modified case. Do you know? While articulating, you must know about the occlusal guideline and its relationship. Here we have canine relationship. What is canine relationship? A maxillary canine occlude with the distal half of the mandible canine and the mesial half of the first premolar. So, another thing you should know, hinge articulator was designed by J.B. Griot. So, dear students, do like my video. Hope to hear from you soon. Take care. Allah Hafiz.